this course is for registered nurses and practical nurses. If you are a registered nurse or a practical nurse, this class is for you. I wanted to let you know that the workbook is out. The workbook is out. The workbook is out. So this is the book that you need to have with you for Monday. And when you go through it, you will see lots of important information. So let's kind of just walk through it together. The pharmacology course is intended to, let me tell you what it's not. Let me tell you what it's not. This is not a class where we're going to be reciting drug classes. This is not a class where I'm going to be explaining the difference between opioids and non-opioids. I'm not doing that in this class. This pharmacology class is a working class, okay? That means that the medications that are in this workbook, the case studies that are in this workbook, we will be having a discussion about. We will be discussing patients and real conditions and matching the medications to the conditions. I sent this out. Okay, perfect. Because I sent this out to everybody's email. You should have it in your email. You should have it in your email. If it's not in your email, it's in your spam. Okay, so this is the workbook that I'm going to be going over. Make sure you have it on Monday. Okay. What about if I haven't started school yet, but getting ready to? I would say this course, this pharmacology course, is going to, it definitely will introduce you to what the expectation is for you to be a professional nurse. So come on. If you got your workbook, take notes. Like, just sit in the back of the class and take notes. The idea is that you have an understanding that this is an investment in your comfort level with pharmacology, because it's really like it's an essential skill. Okay, if you are practicing in the United States, you must be able to do pharmacology work. Okay, so again, when you first open it, the first thing that you're going to notice is that the classes will be 8 p.m. every Monday, 8 p.m. Eastern time every Monday in June. So this is where I want you to set your alarm. 8 p.m. every Monday, Eastern Standard Time. Convert it to your time zone. Another thing you'll notice is that we are doing a discount on the entire V2 program during ReMar Nurse University. So if you don't have V2, which is my full NCLEX review course, this is an opportunity for you to get that. This is an opportunity for you to get that. Okay. All right. So let me open it up. So when you first open it up, you will see the schedule. Now, remember I said ReMar Nurse University happens every Monday at 8 p.m. However, we still have our regular study sessions on Monday during the day. So RNU will take place in the evening, 8 p.m. Our regular scheduled study sessions are Monday at 12 p.m. noon Eastern time. So during this month, I am requiring you to do a little bit more, okay? And that is just coming out to 2 study sessions, but they will be totally different study sessions. If you have not signed up for ReMar Nurse University, I'm going to put this at the bottom. You can sign up to get the workbook if you go to remarnurse.com/RNU. Okay. So we have our regular Monday study sessions at noon, and then we're also still going to be doing Wednesday. We're still going to be doing Wednesday at 9 p.m. So with RNU, you will have 3 study sessions a week. And I know you're like, whoa, not too much on me, but it's really going to benefit you, because what I'm going to try to do is I'm going to try to reinforce the things that we're talking about. So Monday at noon, Monday at 8 p.m., Wednesday at 9 p.m. Okay. If you cannot make it to any of the classes, I will have them recorded for you. I'm going to record ReMar Nurse University. I will leave it up for 1 week so you can watch it, go back to the replay, watch it. That's the question I usually get. Am I recording ReMar Nurse University? Yes, I do. Okay. Again, the calendar, when you print this out, it will have the calendar so you can mark the study days. All right, moving on. The next thing, here are some of the pre-event most common questions about ReMar Nurse University. The first thing is, will I be teaching every class? Yes, I'm going to be teaching every class. Every class will be live. This is a great opportunity for you to come, participate, ask questions from the community, and learn from the community. Is this event free? Yes, this event does not cost a dime. I need you to take that as a sign of my goodwill towards you and my belief that it only takes a little bit of time in order for you to be successful, right? A little bit of focused effort. You just have to be willing to do what other people are not willing to do. And that's really the secret to success. Are you willing to put in the work when other people are like, nah, it's too hard? Okay. So this is a free class. I'm still in school. When should I get NCLEX V2? I will be teaching from NCLEX V2. I will be talking about the NCLEX V2. If you're still in nursing school, I have a nursing school V2 for you, okay? I have a nursing school V2, and that covers your, your fundamentals, your dosage calculation, your med surg. That's nursing school V2. So consider that, okay? New York is in the house. That's what I'm talking about. New York representing. Okay. I have quick facts for NCLEX. How much will the V2 be? So we are doing a sale on the V2. If you already have quick facts, it will be an even lesser price. The sale on the V2 is, I think we put it in here somewhere. I apologize if I don't know it. And the V2 is the book and the lectures. I'm pretty sure. Yeah. So the nursing school V2 will be $69 per month for the entire. This is the sales page for the V2. $69 per month. And then if you already have the Quick Facts book, that price drops down to $49. $49. If you need nursing school V2, if you are trying to prepare for nursing school, you haven't started, or you're very early on in nursing school and you want to get a head start on nursing school, the nursing school course is $29. So that's huge, okay? It was $89. And I see that they dropped the price down. I don't know the prices all the time. So it's $29 per month during ReMar Nurse University. Don't sleep on that nursing school program, okay? The nursing school course. So this will help if you're attending another school. Yes, this will help you. This is a pharmacology course for you to do. All right. Now, again, what this is not an introduction to medications, suffixes, prefixes. I'm not doing that. This is applied pharmacology to patient case scenarios. So we're looking at a patient, we're receiving a report on the patient, and we're talking about how the medications are affecting this patient in a positive or a negative way. This is to prepare you for the NCLEX case studies, these higher level thinking questions that are appearing on the nurse licensure exam. I will say you probably are not going to receive a class like this in nursing school. I really doubt that your teacher would do a class like this in pharmacology, because the curriculum, the ones that I see, ATI, Elsevier, they don't teach pharmacology in this way. Okay. So the next thing after the calendar is going to be a 30-day challenge, where people ask all the time, can you pass NCLEX in 30 days? Yes, here's a sample of how you can do it. This is a study calendar for 30 days on the subjects that you should study in order to prepare for NCLEX. Preparing for NCLEX literally is not a year's endeavor. And you see people when they finish nursing school, because they have been studying, they're able to just do a short review and pass NCLEX. And that's great. The majority of people, 90% of people, will be able to pass NCLEX on their first try. Now, it is the 10%, around 10%, who will not make it on their first try. Okay? And this is actually the time where repeat test takers are getting back into the swing of things. Why don't that 10% pass on their first try? A couple of reasons. One of the first reasons is that they just underestimate the knowledge that is required to pass the NCLEX. People believe because they did good in nursing school, they will automatically do well on NCLEX. No, not how it goes. You have to train for this exam. because it is a general exam, meaning you have to know everything from pediatrics to psychiatry to prioritization. Okay. Another reason is that people, they train, but they don't train according to how they learn best. And they just do those practice questions, or they just read that that Saunders book. They just have that Saunders book. So I want to make sure that you are going to be well prepared. Okay. Hey, I love this. Mary, hey, I've been looking for Mary. Mary has been a very consistent follower, a very consistent participant. Hello, ReMar family. Glory to be to Jesus. I took my NCLEX. Oh, I know you international writing like this. May 28th, 2025. I passed at 85. Had a quick result. Look at my results today. NCLEX is indeed about content. I used ReMar only. I am so happy. Mary, I am so excited to see your name here. That means that you will be moving on to the next level. That means you will be moving on to the next level. So we will certainly miss you. We'll certainly miss you. But yeah, you can really pass NCLEX. You can really pass NCLEX. All right. Going over the workbook. Hey, that's the military date. You know, when I was in Kenya and I had to sign some paperwork, that's how they wrote it. We're going over the workbook. This should be in your spam. If you signed up for this course, ReMar Nurse University, the workbook is in your inbox right now, or it is in your spam. I'm telling you this so that you can print it out for Monday. We're going over the workbook. Now, what you're going to notice is you might be wondering, okay, if we're not talking about prefixes and suffixes and drug classes and side effects, how are we going to learn? How are we going to learn? I didn't see dosage in the book. So dosage calculations is reserved for my nursing school V2 course. So nursing school V2 course is where I have those individual classes. So that is where you're able to look for that. Okay. Somebody says I signed up for everything. I love it. Okay, so we are going to actually be doing, and I started my work already, we're actually going to be doing case studies. Okay, we're actually going to be doing case studies. So I started doing ReMar Nurse University early this morning, like at 3 a.m. Our first patient that we will receive is a 54-year-old female. She is coming in with episodes of chest pain, history of anxiety, hypertension, cigarette smoking, and obesity. So think about what this patient looks like. Now, in addition to this, we are given a list of medications for this patient. We're actually going to be looking, and this is one of the reasons why I love ReMar Nurse University, is because we're going to be looking at actually a chart of your patient. This is seeing how you put it all together from like a top-down perspective. That's what makes this pharmacology course so different, because we're going to be looking at your patient's medications, your patient's labs, and your patient's vital signs. All of these things work together to tell a story. If you are trained in nursing school to only focus on the medications and you don't understand how the labs are affecting it, then you will miss details about how your patient is changing. If you don't understand labs, and I'm not talking about just knowing the values anymore, because remember, NCLEX gives you those numbers. So I'm going to give you those numbers. Those numbers are meaningless. It doesn't matter if you memorize them. It's about, hey, do I know what they mean? Do I know what they mean for my patient in this moment right now? So this is how we're going to study pharmacology during ReMar Nurse University. So every Monday, it's just once a week. Every Monday, we are going to get a new patient in a new scenario. So please bring this to class, because it's a lot to have to discuss if you don't have it in front of you. It's a lot. And I want you to be able to keep up. Like I said, RNs, PNs are going to be appropriate for this. RNs and PNs are going to be appropriate for this. As a licensed practical nurse, medications are your top skill. You're passing meds. Most LPNs, just according to the research, are going to graduate and work in nursing homes. They're going to work in long-term care facilities. That's where most LPNs are working. So you're passing medications. You must know this stuff. Registered nurses, the majority of registered nurses are working in hospitals in a med-surg or progressive care type unit. And I'm talking about new nurses. The reason why I'm focusing on new nurses is because that's what the NCLEX is based on. It's based on new nurses. So do you have to know this? Absolutely. If you're working on a med-surg unit, you can't afford to miss this class. Okay. So every week, every Monday, and then we're also going to be having pages from the V2. So of course, I will also be orienting you and answering questions about this book right here. This is my V2 program. So we're going to be doing both pharmacology, and then the back half will be how do I become successful using the system of the V2? How do I use it? How does the training work? And that is literally ReMar Nurse University. It's every Monday, making sure that pharmacology is something that you are prepared to speak about, something that you're prepared to be fluent in before you take your exam. That's it. So I wanted to make sure that we start off on the right foot, because the time actually, it came up on us so fast. So if you haven't already done this, download the workbook, find the workbook, download it, and get your notebook out. Make sure you have pen, make sure you're ready to go, set your alarm, and invite somebody, because like I said, this class is around the time when actually repeat test takers are trying to get back on the horse. And this is a great way to jumpstart that. So live sessions with me every Monday at 9 p.m. We're going to assess, we're going to challenge what you know, what you think you know, what you're coming to class to learn. All of that is going to be happening. And of course, our community here. So I want you to understand that you're not alone on this journey. It's great if you could bring somebody with you. It's great if you know somebody that's also studying. Hey, let's do ReMar Nurse University together. Let's see how we do with these case studies. Let's see how we know how much we know quick facts. This is a very unique time in your nursing career. Most of you will be able to go on and get your nursing license, and you will be working before you know it. How quickly you start working all depends on you. All depends on you. If you take this serious for just a short time. I was talking to my brother about this. People think success is some magic formula, some mystery. No, it's really just focused attention for a certain duration, okay? And being able to do what other people won't do. That's how you become successful in anything. Just being able to sacrifice where other people are like, I'm not doing all that, right? I need to sign up. Can you send me the link? It's right down here at the bottom on the ticker. You go to remarnurse.com/RNU. And so success is something that you already have proven you are willing to work for, okay? You're willing to work for it. Nursing school, huge challenge and obstacle. Most people won't make it through nursing school, right? Or they start it and then they stop it because it's too difficult. But for all of us who enter in and we endure until the end, we find that the reward is worth it. Is worth it. I say, like, nursing school is challenging, but there are things that you can do to make it easier. There's studying you can do now in order to feel like you are drinking from a stream that's gently flowing instead of drinking from a fire hose. Because if you just go in nursing school blindly, you will feel like you are trying to catch water from a fire hose that's shooting out. Okay. So we want to make sure during ReMar Nurse University that at the end of it, you're able to get the resources that you need and you're timing out your studying. We should not be studying this class. This class should be no longer than 45 minutes to an hour. If it's longer than the hour, then either I'm talking too much or you all have questions that are keeping us in the class long. Not a bad thing, but I'm just saying when we study for an exam like this, we want to make sure that we're being realistic about how much we're using for our attention and how much we're being distracted by other things. So I want to challenge you to use social media to make your life better this month. I want to challenge you to look at social media as a resource to you and not a resource and not a liability, right? Mm, I was listening to this thing that said TikTok for people who use TikTok a lot, right? I'm on TikTok a whole lot. Uh, Sometimes I'm working, sometimes I'm recording, sometimes I'm just scrolling. But somebody said they named it TikTok because it was intended to steal your time. And that's what TikTok meant, is that you would give so much time to this application that you would not even be able to count it, right? That's a scary thought, right? So I'm trying to teach myself and I'm trying to teach my children, everything in your life that you're utilizing, understand the purpose of it. Because if you understand that the purpose of an application is just to steal your time and not give you anything in exchange, you become more aware of how you are engaging with this application. It's the same thing with Facebook, right? So let's be the challenge that people were not expecting, right? Also, let me say this. In order for you to also get forward in life, sometimes you have to prioritize yourself. And so this month, you might have to be a little bit selfish about what you are doing, where your time is, where your thoughts are. I want you to be unwilling to compromise when it comes to this. I want you to be unwilling to put your goals aside in order for somebody else to become the priority. Now, I'm not talking about your children. You know, if you're a mom and you have your children you have to take care of, but you absolutely will be in a better off situation to care for everybody when you have your nursing license. Okay? And so in order for you to get there, we have to be a little bit selfish. So start having that conversation with yourself. Okay? I know. Not too much on y'all, but it's June. And so what that means is that it's June here in America. We'll be celebrating 4th of July in the next month. And then after that, it'll be back to school. Y'all know it'll be back to school shopping. And then after that, then it's Halloween, Thanksgiving, Christmas. Year's over. Year's over. That's how fast it's going. So do the work now so that by August, by September, you have your nursing license and you are going into the holidays in a Juneteenth. True. You know, you're going into the holidays in a different position. And that's for those of us who can take the test. For those of us who are in nursing school, you're using this summer to you're using this summer to make sure that when fall comes, you're not looking around like you have no idea what anybody is talking about. You're going into class already prepared, already knowing what the course is going to be. That's how you do well. That's how you're able to, like, just position yourself differently. It's all preparation. That's the only difference. That's the only difference, is who's practiced and who's not practiced. That's it. So I just wanted to come on here and orient everybody to ReMar Nurse University. It's a really amazing opportunity for you to take it to the next level and use social media for the good. Make sure that your priorities are in order as you go into these busy summer months. Kids are home. Lots of, beautiful sunshine all over the country, but at the end of the day, we want to make sure that the license remains your priority. So thank you so much. I will see you on Monday. I'll actually see you on Monday at noon. We'll do a regular study session at noon, and then we have ReMar Nurse University the first night. Let me take some quick questions. I have my exam set for June 4th. Do you have any recommendations for me? How have you been studying? Let me know. June 4th is right around the corner. So for you, I'm not sure how you've been studying, but I would say at this point, because your exam is just a few days away, you should be doing practice questions, doing case studies, just getting your mind into the habit of answering without hesitation, without second guessing yourself. You also should be working on your hydration, your diet. This is a time where you need to be eating clean, increasing your prayer life, making sure you are not taking in any anxiety into this situation, because it's almost like it's almost like giving birth in a sense, where nobody can really tell you how it is. You just see people coming out successful, you see people with their license, and they tell you, when you get in there, you just have to stay focused, you have to breathe. It's kind of like giving birth in that sense. But I will say honestly, there's things that you can do apart from just studying and training that will put you in a better situation. And I think eating clean, making sure you're hydrated is one of those things, because this can be a 5-hour test. This can be a 5-hour test for some of you, even taking breaks. So it requires discipline to sit there. Okay, it requires discipline to sit there. So think positive and you can do it. Okay. Are you doing one-on-ones, please? So one-on-ones are, all of my training is done with the V2. So that is the best way to prepare for this exam. The reason why I say it's the best way is because the videos are there for you. The training is there. The question bank is there whenever you need it. Whenever you need it and how much you need it. And to me, that is a better way to actually prepare for this exam than doing one-on-one. So I don't have the one-on-ones, but I do have the entire system of the V2. The entire system of the V2. Okay. Okay. All right. Awesome. So everyone, let's make it our priority. Let's make it our business to focus in, dig deep, give 120% during RNU. What does that mean? That means showing up for every class. It's 4 weeks. Showing up for every class. And one of the classes is a game night. One of the classes is a game night. So it's Kahoot. We haven't played Kahoot in a long time. See if I can see which one it is. June 30th is actually the Kahoot game night at 8 p.m. So it's 4 weeks and then 4 weeks and then Kahoot game night on the 30th. So fun stuff, fun stuff. I'm a ReMar nurse, passed at 85 on Tuesday. Look at that. That is what I am hoping, that I will be able to get a few testimonials out of those who showed up for ReMar Nurse University. Tasha, I'm so happy about that. I really am. I'm so happy about that. Coming on here as I talk about ReMar Nurse University and saying, hey, I'm a ReMar nurse. I'm a ReMar nurse. 8 p.m. Eastern Standard Time is when our classes begin. Hey, it's not too late for you to sign up for ReMar Nurse University. How about that? It's easy to do. Right on the lower part of this screen here, if you have not signed up for this workbook or you don't have this workbook, you needs it. Okay, go to remarnurse.com/RNU. Check it out. Check it out. And I will see you guys on Monday. I'm so excited about this class. It's opening up. Let's get ready to be pharmacology majors. We're going to dive into it. It might come with blood, sweat, or tears. It will all be worth it when you get that nursing license. You see that number, that digital license. The jobs, guys, the jobs are out there. I don't care what nobody says. The job market right now, unbelievable, unbelievable. So let's do this. Let's make sure we have an awesome 2025 into the future. I'll see you on Monday. Bye.